In this video, we are going to discuss about the shoulder dislocation. So the signs and symptoms again are the same, which includes pain, swelling, deformity, loss of movement at shoulder joint. Now, mechanism of injury, how the shoulder dislocation occurs is fall on outstretched hands plus abducted shoulder plus external rotation. All these components when are associated with push that can result into the dislocation of the shoulder or the direct blow either anterior or the posterior on the shoulder joint can lead to anterior or posterior dislocation of the shoulder respectively. Now coming on the classification or the types, you can say this is the normal annate of the shoulder joint. Now this is the anterior dislocation, that is the posterior dislocation. Anterior dislocation can be either preglenoid, it can be subcoracoid where it is beneath the coracoid, and it can be subclavicular when it is beneath the clavicle bone, and it can be posterior dislocation. So this is why the classification for shoulder dislocation. Now, looking upon pathologies, there are two pathologies, namely Bankhart's lesion and secondly is Hill-Sachs lesion. What is Bankart lesion? Whenever the head of the humerus goes and strikes against the labrum, this will tear off the labral, or you can say labrum, from the bone. So this will cause labral tear and it is known as Bankart's lesion, that is caused by anterior dislocation of the head. You can appreciate here. Now in Hill-Sachs lesion, the Bankart lesion was on the labrum while the Hill-Sachs lesion is on the head itself, where the humerus head dislocates anteriorly, it strikes with anterior edge of the glenoid, right? And lesion is formed in the form of depression in the posterolateral quadrant of the head of the humerus, as you can appreciate here. When it goes ahead and strikes to the edge of the glenoid cavity, it will result into this depression, and that depression is called Hill-Sachs lesion. Now coming on to the diagnosis, there is history of fall. On examination, we can see that the patient is unable to touch the opposite shoulder, which is known as Dugas test, or you can see the flat shoulder, where you can place a ruler which will touch lateral condyle of the humerus and acromion simultaneously, and that is known as Hamilton's ruler test. And you can also see the vertical circumference of the axilla has been increased, and that is known as Calver's test. And you can also take the X-ray in the AP view that will be suggestive of the dislocation of the shoulder. Now complications can include axillary nerve injury or recurrent dislocation. For management, we have close reduction of the shoulder, the well-known technique known as Kocher's maneuver. Here is the first step in which we have to give the traction in this direction, right? After traction is given, the arm is externally rotated, followed by adduction of the arm, externally rotated, adduction of the arm, and then internal rotation in the stage 4. This will reduce the dislocated shoulder back into the glenoid cavity. The second one is Hippocrates method. Or maneuver. Here steady pull is being given in the semi-abducted arm, as you can see here. The pull is given in this direction and the foot is used as a fulcrum, right? Here is the foot of the surgeon. The traction is given in this direction. The foot is used as fulcrum and the head is positioned back using the foot as fulcrum. So that was Hippocrates method. The other methods apart from the Kochers and the Hippocrates are putty plate, Bankarts and Bristows. These are operations, and here as an undergraduate we do not need to write down the method of or the steps of this operations. The names are enough. So this was all about shoulder dislocation.